Hello everyone. Now we will start our next lecture about understanding research in diabetes. This is me, your Dr. Aarti. As we have discussed before about diabetes, its diagnosis and all. So today this is our topic and we are discussing about this further. Why we consider this lecture as an important tool is we consider all the integration based data that we use in our modern clinical practice that helped us in our research and in our diabetes treatment in much better way. Okay, so you will let to know why this lecture is important. This is very short and concise lecture and I hope you will like it. So, why research in diabetes is important? Due to increasing global prevalence, that is epidemic proportion, prevention of complications, that is retinopathy, nephropathy, neuropathy, and CVD. I think everybody of you know what are that complication. Till this stage, we have discussed this much about diabetes. You should know about retinopathy, nephropathy, neuropathy. Development of new drugs and therapy. That is our a very good topic for today actually ki why we need to develop new drug due to its side effect and due to, as you know, the population right now is not so much compliance with the drugs. So we start the new drug therapies and it might be helpful to some and maybe not too helpful to all. So improving patient outcome and quality of life, organization like WHO, World Health Organization, and American Diabetes Association regularly publish research-based guidelines so we can get a better outcome of everything and improve the quality of patient life and get more new drugs. So for this we have to understand the scientific research methodology that we are using. So we have four type of research right now we are discussing about it. That is basic research and clinical research, epidemiological and translational. Basic means what? The mechanism that you everybody know about beta cell dysfunction, insulin resistance pathway. This deals with the basic research, that is its level up to cell and molecular mechanism. Okay, now the next is clinical research. This is conducted on human subject, like testing new anti-diabetic drugs. Key which drug is important, why it's important, what are the side effects of this drug, and why we need a new drug basically in market. So this is what is deals about. Epidemiological research studies disease distribution and risk factor, prevalence of diabetes in urban and rural population. Translational research convert laboratory findings into clinical applications. The type of study design, we have observation studies, cross sectional, a case control, and coherent. I think this all you have read about in PSM and all that posting, but still we can make it in a very concise volume to let you understand in a much better way. So the purpose of these studies is to identify association and risk factor. As we all know, in this study we have two groups. One is the risk factor group and one is the healthy group. Okay, like suppose we are taking as a smoking as a risk factor, okay, as a family history. So we consider healthy people and the people who are taking smoke. Okay, like two different factors and the risk factor we'll consider, and we take the patient like in future in backward depends on our study design. Okay, so example, obesity as a risk factor for type 2 diabetes. So we consider patient that are obese and that are non-obese, and we will consider कि किस में risk development किन patients में कुछ पतले लोगों में diabetes हो जाता है and but majority risk factor is obesity. Okay, तो we will continue it 5 years 10 years depend on our survey lines कि हमें कितने टाइम तक रिकॉर्ड करना है, कितने बैकवर्ड डाटा में जाना है. So the next is experimental data, that is randomized control trials. That is gold standard actually. Okay, so what is the thing is कि sometime what is the importance of randomization is it reduce bias means कि ये जो false information है या we get biased कि हमें ये लेना एक random research में क्या होता है ना, random answer मिलता है and that probability of getting a right value, the predictive value would be more better with this. That's why I consider it at the gold standard features. Feature could be random allocations, control groups, and reduce bias. Establish cause effect relationship. Example could be comparing metformin with the new drug efficacy. The next about is case control studies and case reports. And in this we usually need a expert opinion that is higher level, and we have a strong evidence about it. The evidence based medicine in diabetes: integration of best research evidence, that is or clinical expertise, patient values. These all are important actually. Diabetes or any another that is a chronic disease, they are not just depend on one thing. Okay, so we need research, we need clinical expertise, and the patient values about it or not. So steps that we follow is ask clinical questions, search for evidence, critically appraise evidence, apply evidence in practice, and evaluate the outcomes. For example, why metformin in the first line drug? Because of what? Okay, because we, as according to our test and lab data, we find it कि इससे HbA1c, that is alpha A1c, decrease हो जाता है, and it's improve insulin sensitivity, and it's decrease mortality risk of the patient. So we should know कि वी शुड कंसिडर एवरी स्टेप्स ऑफ द क्वेश्चन कि हमें क्लिनिकल क्वेश्चन पूछने हैं, हमारे पास एविडेंस भी होना चाहिए, स्ट्रॉन्ग एविडेंस होना चाहिए कि क्यों ये हम कर रहे हैं, वाई वी आर डूइंग दिस. तो हमें एक प्रॉपर मैकेनिज्म, एक क्लिनिकल डाटा, उसको प्रैक्टिस में कैसे लिया, उसमें प्रैक्टिस में रिजल्ट कैसे रह रहे हैं, एंड पेशेंट उससे कैसे डील कर रहा है, क्या साइड इफेक्ट है, ये सब वी हैव टू नो इट. Only we can get a better outcome of any of the disease. The current trends that we are following right now in diabetic research is precision method. Actually every drug is not effective to every patient, because every patient is little bits are different and different reaction to a lot of things. Okay, कोई मीठा खा के मोटा हो रहा है, कोई नमकीन खा के मोटा हो रहा है, कोई एनी हाउ मोटा होता जा रहा है. It's just something genetics. So that's why it's important for patient right now and for doctor also to personalize treatment based on the genetics, tailor therapy for individuals. Okay, you should understand ki in which patient which dose and which diet, they get a good result with it. And the next is continuous glucose monitoring. Only then we can know ki okay, after eating this I have this much glucose spike, after eating that I have this much glucose spike. So this is important, real time glucose monitoring that improve glycemic control. Actually if you want to control by yourself, okay, because this is self monitoring. Now if you are interested कि I should get rid of this disease, I should let my diabetes in my control, so only then you can do it. Otherwise people don't do such things. Okay, we need to tell them कि okay, make this chart, take this glucometer, and try doing this after, before, and what are the food you think you want to eat. And because if you tell patient not this, not, there's a lot of thing कि हाँ this we can eat, na jaggery we can eat, this we can eat, that we can eat, but it's in a lot of things it's usually the answer is no. Okay, so to let the patient ki this what is the real glycemic index and all, so we can tell patient to monitor the glucose, and they get to know by themselves actually. And the next is artificial pancreas, automated insulin delivery system is there. And next is stem cell therapy, that is beta cell regeneration research. Maybe in future we have this. And the new drug classes, I think this is we are using right now in our patient also. SGLT2 inhibitors, GLP-1 receptor agonist that benefit our heart system and help in weight loss. Because of weight loss, because patient due of diabetes is already having history of obese, and because of these drugs the patient is gaining weight. So this is very good drugs actually, because patient become, if he gain weight, then a lot of new problems might be occur, like heart disease, hypertension, and maybe related to bones if the age is old. So this drug better helps in such patients. And next is our integration with traditional wisdom and with modern research. Like Ayurveda, we have a different lecture for this, but little bits I concluded it here, because obviously your diet, the nature we had dealing it, we are living it, it has all the remedies, right? So Ayurveda is very important for I think a lot of disease, and being this diabetes, it's very good if you take a good diet and a lifestyle, because these are lifestyle changes we need to do for this. The Ayurveda are being studied scientifically under organization like Ministry of Ayush. Example, traditional remedy, modern evidence. Jimegema sylvester improve insulin secretion, fenugreek reduce blood sugar, turmeric is anti-inflammatory, improve insulin sensitivity, bitter gourd as कि जो भी diabetic patient होता है we have to suggest them, okay, You can try bitter gourd, bottle gourd for better index. So this is good actually. We should never forget our roots, and Ayurveda is our root basically. And I love the modern research methods, but with this we can improve our diet, and I think it's must, because even if you don't have disease, still you have to maintain a good diet. Now only then you will not have a disease. Like precaution is always better than any disease. The important concept about it is evidence-based validation for research therapies, critical appraisal of research. When reading the research, we have to evaluate study design, sample size, any bias is there, and the p-value, that is statistically significance, that is PQ values we have in our preventive health management things, and the clinical relevance we need to check. And what are the statistically data ना, is not always we get in result कि जो हम statistics से हमें जो मिला and clinical भी same apply होता है. This is not always true, so we can't just tell कि हाँ जो we have a theory of it and we get the same result in our clinical practice. It's a lot of times is different actually. And the current trends that we are following in diabetic research could be the precision medicine that we I think this repeats slides, yeah, okay. So the application used in clinical practice. So we take an example like the patient is having type 2 diabetes, because type 1 we don't have that much changes we can do in our lifestyle, but with type 2 we can do a lot of things, and especially with pre-diabetic, we can do a lot of things. Our next lecture would be about it. So the type 2 diabetes and the patient is obese. So according to this, we have evidence-based approach that we have is obese and type 2. Lifestyle modification is the first thing. Then metformin in our first line treatment, and we can add GLP-1 agonist if needed, and the monitor HbA1c for every 3 months. Future direction in diabetic research, gene therapy, this is we are not using till the time now. We are using metformin and GLP-1 and lifestyle modification. Our results are much better if patient consider it. If not, then this is the future of technology, that is artificial pancreas development and diabetes prevention strategy and regenerative medicine. The lifestyle and nutrition studies in diabetes we can do is, it is a core component actually for diabetic management. The lifestyle and nutrition is must, even in hypertension, in diabetes, even just suppose you have an allergy to any food, then you have to stop eating that food now, or rather you want to eat the food and take medicine, so it's a foolish thing. So diet and lifestyle is must for every management of any disease, and the recombinant, and we recommend as the first line therapy in diabetes type 2 that helps blood glucose naturally, reduce dependency on medications in early stage. Multiple clinical studies show significant improvements with lifestyle changes actually, and we have seen this. For all the pre-diabetic, we never recommended medications. We recommend them to make a lifestyle change and visit it regularly, okay. We have to do the RBS and the HbA1c on a regular basis, only then we can start medication. And a lot of people, if they're well educated and their family little bits are educated, they consider key small values affect your lifestyle. And even if somebody is acknowledging the disease in the family, then the patient won't be a patient, he's a healthy then. And the improvement we can see is blood glucose level, HbA1c, insulin sensitivity, and patient symptoms. Okay, the key clinical finding what we noticeable improvement within a few months when proper diet and lifestyle changes are followed, and that is observed. The improvement include the reduced fasting blood glucose, improve post-prandial glucose level, increase energy levels, and reduce fatigue and weakness. The timeline of improvement could be within few weeks. That might improve glucose control, better energy levels, and within 2 to 3 months we get a significant reduce in alpha HbA1c, and that improves insulin. That means actually that insulin sensitivity is improved, and the long term could be better metabolic control, and the complication is reduced, okay. So might be there's no complication, the person is in control. So this we have discussed, but I would like to repeat it. The mechanism of lifestyle improvement could be increasing insulin sensitivity, improve glucose uptake by muscles, reduce insulin resistance, and supporting beta pancreatic cells functions. So that consider the role of diet. role of physical activity, and outcomes would be better for you only. So the effective dietary strategies include low glycemic index food, high fiber intake food, reduced refined sugar intake, balanced between protein, carbohydrate and fat is must. You can't say carbohydrate is not important. You can't say fat is not important, and you can't say protein is more important. Okay, everybody, everything, even a micronutrients or macronutrients, every single thing we need in our body, but in a proper dose. Okay, you can't make imbalance between the things that our body needs it, how much percentage, what does it need, even a micronutrients that we need, if it exceeds or become toxic, then why not these things? Okay, these won't make, we don't have a term like toxicity for these protein, carbohydrates and fat, but the result you can see. So the example could be whole grains, vegetables, fruits that control portions, because fruit might increase the glucose level also. And the role of physical activity could be regular physical health that reduce blood glucose level, improve insulin sensitivity, reduce your body weight also, and improve CVS health that recommend a 30-minute brisk walk. Not just walking, like if you walk fast, then like all your muscle get active and start using more energy, more glucose, and that make you better. So walking, yoga and all the aerobic exercise are very good for all type of patient. Okay, and yoga, walking, so it's best actually, everybody can do. And they are, as we all know, okay, what could be the better outcome. And the role of diabetic prevention could be lifestyle change. Number one, prevent progression from pre-diabetes. That I'm telling you, okay, we can do a lot of things with pre-diabetic, and the patient, we can't say it as a patient, we'll say a healthy person. And the delay onset of the type 2 diabetes, and the reduced long-term complications, as according to the clinical recommendation, we can say healthy lifestyle, healthy diet balance, regular physical activity, weight management is very important for everybody. A lot of people are overweight actually. Okay, and you are not serious about your overweight. Okay, it's okay, ठीक है ना, fine, I'm not looking fat, I should not, but everybody is I think that much intellectual in this meeting ki they know what is BMI and how to calculate it. And to all the young generation, I would like to say कि आप अपनी family सभी का do make a term of the BMI, and according to Indian standard guidelines, we have a different rate little bit for BMI like 25, and but in standard countries we have 22, 21. So consider it as Indian, and for you take it as American and association to be 22, and calculate it by yourself and get who is overweight in your family and who is obese, and get a better lifestyle to them, because they are getting old, so you are. Okay, the conclusion for this could be lifestyle nutrition significantly improve diabetes outcomes, and most patients shows improvement within few months. Okay, if you do something nice, it won't take you some years to give you an outcome. Few months is very good, like 2 months, 3 months, you will get something, you will get ki ha, I am getting fine and this is suiting me and I will continue this. Okay, so it's, you feel it, you start feeling the change in yourself itself. Essential component of diabetes management, and should be integrated with medical therapies if needed. If you need ki the patient is not getting better, or its level, the glucose level is too high, then we should start it. Okay, and if he can't take control of the diet and he's living in such environment that he has to do something, a lot of exceptions we find, and then we have to start medications. So we do it because anyway it's patient need and it's necessity of the time. The skill outcomes due to this could be, we have to apply evidence-based guidelines in diabetic management, integrate lifestyle modification, nutrition and pharmacological therapy, develop individual patient care, monitor and interpret clinical parameters such as HbA1c, that is important, and that gives a very accurate value. Okay, FBG and PPBG and BMI metabolic indicators, make safety and effective treatment decision based on scientific evidence. And this is all about the studies that we have discussed. Understand the hierarchy of evidence, randomization, control trials, cohort and systematic reviews and meta-analysis. That is a top one, meta-analysis. and we use research data to support the treatment selection, okay, and avoid outdated and non-evidence based practice. We won't do that. That is following the trends, that in the guidelines we have to follow the guidelines. Of course you might think, okay, you have knowledge enough to do a lot of things, but not research collection, as we have discussed before. I think I don't know if you remember or not, but I have mentioned you, okay, what are the clinical data that we get is not is not always that we find the same data. Na? See, statistically data is not always we find it in our practice. Sometimes it's different, and even a lot of times it's different actually. So we can't just focus on the data that we are reading in our books or whatever. We have to understand ki, okay, fine, we have to do research, okay, and then people before us are doing it, and I think it's important they have done it. They have took their time and they made the data and they have written the articles, and because of that we have standard guidelines for every disease and we have to follow this. Just don't weigh in the knowledge of books. You should understand why we have this lecture is integration, evidence-based decision skill making, and that is why these things are important. And lifestyle intervention we can do is exercise, weight, and your physical activity. Nutrition therapy, medium nutrition therapy, medical no glycemic index, and calories and carbohydrate control, that we consider in our next lecture. And selection of appropriate anti-diabetic drug and monitoring drug effectiveness is very important. Okay, I start giving metformin, I start giving limipride, and what are the effects, what are the values that a patient is getting, because we have different dose like 500 mg, 1000 mg, 1 mg, 2 mg, depends on the patient RBS value or HbA1c, we can change them. So we have to check which dose and which drug is affecting the patient and adjusting treatment based on the response of the patient. The clinical monitoring and evaluation skill, monitor progress effectively, evaluate treatment response, identify early signs of complications, modify teaching plans accordingly, like key monitoring index, as we all know right now. At the end of the lecture, all of the things I think you understand, okay, what we are doing right now: HbA1c, blood glucose, symptom improve, energy and functional status improve. And we have to tell patient, we have to educate the patient, because such diseases are long term and we have to do a lot of take care of the patient, and patient has to take care of themselves also, because a doctor is not with the patient 24/7, okay, he just come once a month, twice a month, sometimes 3 to 4 times, that's it. More than that the patient, they won't even come to us, because after all they consider, okay, they are for money or what are the reasons they got it, but patient don't visit you regularly, okay. So we have to educate patient about the diabetes for their self management. Explain lifestyle nutrition is very very important, because you're not with them, you're not guiding them 24/7. So very strict diet chart you have to maintain. And teaching and patient education will come to our point. Educate patient about diabetes self management. Let's explain lifestyle and nutrition importance. Improve patient compliance and adherence. Promote preventive healthcare practice. This improves treatment outcome, patient confidence, and long-term disease control. Our research and academic skills should be read and interpret scientific research articles, critically analyze research quality, cite recent publication clinical practice, and apply that research finding in the real world patient care. The conclusion of all these lecture is about the confidence in our clinical practice, and that highly recommend lifestyle modification, evidence-based medication, nutrition therapy, monitoring protocols, and result we have a better outcome and improve patient complications and great confidence in you. So thank you for your attention. Have a nice day. If you have any question, you can text me somewhere on my mail or my Instagram, and you can text you the author of the this handling this page, and I hope I can question answer your all questions. Thank you so much.